I'm going to pass it over to our host, Carlos, who is the Director of STI Outreach and Training at the New York City Department of Health and Mental Hygiene. Really excited to have him here today to kind of give us all the info, things that we probably don't know. And yeah, I'm just going to pass it off to Carlos. Let me just stop my screen share. And thank you so much, Carlos, for being here. We appreciate it.
Thank you for having me and welcome everybody. As Sarah mentioned, my name is Carlos Cubas. I am the Director of Outreach and Training in the STI program for the New York City Department of Health, Bureau of Hepatitis, HIV, and STI. And I work in the STI program. So thank you so much. Today, we're going to be covering a lot of material, and I will try to make it as lighthearted as possible, but please feel free to ask questions while I'm talking, after I'm talking. If you remember something after the fact that a topic came up, bring it up anyway. It's easy to go back so that we can have a discussion. What I want all of you to take away from today is to be able to feel comfortable discussing sexual and reproductive health and sexual health in general. With sexual health, your mental health is also connected. So please make sure to put a connection with that, because we're going to be making connections in the discussion for sexual or reproductive health with your mental health as well, because it's all interconnected on how you access services and how you receive services. Because you may not feel like you could talk about this freely with the doctor or a colleague or a friend. And that may cause anxiety, that could cause stress. And we're going to cover some of these a little bit later, but I just want all of you to keep that in mind while we're having this discussion. And like Sarah said, no question is off limits. Use the language that you feel comfortable with. I'm going to be using the language that we use at the Department of Health and with the public as well. But if you feel more comfortable using different words, it's fine. We're all adults. I'm an adult. I feel like I've heard almost everything, so feel free to put your questions in there or to ask Sarah directly, and we'll get to your question and or concern right away. So without further ado, I'm going to start sharing my screen. And you should all see a blue screen that says Sexual Health 101.
We see. We're good.
Okay, great. And as I said, my name is Carlos Cubas. Here is some information about where I work at the New York City Department of Health and Mental Hygiene. A little bit of background on me. I've been working in public health since 2010. My background is actually retail, if you can believe it or not. And I had a business with my family here in the Regal Park area near where the Target is. We had a furniture store for 12 years. And while working there, I saw a lot of people with a lot of questions that had absolutely nothing to do with what they were buying. And that piqued my interest as to why do people share so much information with strangers? Because I was a stranger, I'm just there to sell them furniture. And when that piqued my attention, I went to volunteer at different locations, and I ended up being offered a job at a place called Queens Pride House, which is the LGBT Center of Queens in Jackson Heights, like in the heart of Jackson Heights, 37th Avenue and 76th Street. And I worked there for 6 years before moving on to the New York City Department of Health. And I've been there for almost 4.5 years, which I cannot believe I've been there for so long already. So that's a little bit of the work that I've been doing. And in my work, I have worked with a lot of different demographics, including people that are our ages, and I include myself in there because I'm going to be 50 soon. So it's a lot of this discussion that I saw while working on the streets, doing community engagement and outreach was focused on youth, was focused on protection from pregnancy. It was focused on recreational drugs. It was focused on what I felt was a very youth-oriented way of discussing sexual health. And it didn't really, in my opinion, it didn't really cover much, at least the work that I was doing. It didn't really cover much about the demographics of, well, what if you're not concerned about getting pregnant? What if you're not necessarily concerned about having a partner for 20, 30 years? What if you're thinking more of in the moment? And that's where a lot of this discussion is going to lead into. So again, keep that in mind when you come up with questions. Any question is okay, so just let me know. So we'll jump on to the next slide, which is what is an STI? Now, STIs stands for sexually transmitted infections. They used to be called, or are still called, STDs or STD, which is sexually transmitted disease. And the change happened, I would say, maybe around between 2012 and 2015. STD started becoming STI because disease didn't really cover exactly what was going on with sexually transmitted infections. Because you can have an STI or an STD and not have any symptoms. And the word disease really meant, or the word disease really felt like people thought that it was something you can see, it was something you can feel. And infection really covers more as to what's going on with different things like gonorrhea or herpes or even papillomavirus. It's something that can happen, that can live in your system and not necessarily have any symptoms. So STI is the more current, more accurate name that we use. They also used to be called venereal diseases. Since I work for the New York City Department of Health, I also promote the New York City sexual health clinics around New York City. We have 8 of them around the city. And I remember when I was much younger, my son's age, these clinics used to be called the venereal disease clinics, although I never necessarily made the connection because I was too young to understand what that meant. Now that I work for the Department of Health, I realized, venereal disease was STD, which is now STI. But they're called sexual health clinics so that everybody is on the same page on that. And I will put that information at the end of this training in case you ever want to visit one or you need to find one. And like I said, many people with an STI have no symptoms. So you can feel healthy and not know that you have an STI. And of course, the best way to know is to get tested. And you can get tested at one of our clinics or mobile units. There are dozens, if not hundreds, of different partner organizations in the city that offer sexual reproductive health services for free or that are covered with Medicaid, Medicare, or health insurance. But if you do have any of the following symptoms, we encourage you to get tested right away. If you have discharge from the penis, unusual vaginal discharge, and when I say unusual vaginal discharge, is that, as we all should know, the vagina does discharge on occasion, and you would know if it's an unusual vaginal discharge, if it's a different color or a different substance. If there's burning while urinating, or if you have intense itching, bleeding, sores on or around the vagina, penis, or anus, or stomach cramps unrelated to menstrual cycle, or stomach cramps in general, which applies to cisgender males, which applies to men as well. If you have stomach cramps that are not going away, it could be related to something else. So please make sure to go to your doctor and mention all the symptoms that you have. Now, before I jump into the first STIs that we're going to cover, does anybody have any questions on what I just talked about? I know I used a lot of terms that may be unfamiliar or that some of you are not comfortable using. So if you do, let me double check the chat, and for some reason I can't see it. I move my screen. Sarah, I'm sorry, I can't see the chat for some reason, or the Q&A. Is there anything there? Oh, there it is.
Nothing's here yet. Yeah.
Okay, great. It was hidden on my second screen. Sorry about that. All right, so we'll jump right into the first STIs, which is going to be chlamydia and gonorrhea. So chlamydia and gonorrhea, this is just a quick overview of chlamydia and gonorrhea, and then we'll really dive into it a little bit more. Chlamydia and gonorrhea are both bacterial infections. And today we're going to discuss bacterial infections, viral infections, and parasitic infections. So 3 different categories, which I'll mention to you when we start talking about them. Chlamydia and gonorrhea both spread through oral, anal, or vaginal sex. Condoms and dental dams do offer the best protection. And many people with chlamydia and or gonorrhea have no symptoms. And we're going to discuss the symptoms. Now, chlamydia and gonorrhea, they're 2 different STIs. But usually when somebody gets chlamydia, they might also get gonorrhea at the same time because they're so prevalent. Chlamydia being the #1 STI, at least here in New York City, that people are getting. So symptoms can include discharge from the vagina that is different than usual, bleeding between periods, a drip from the penis, pain or bleeding during or after sex, pain during urination, constipation, rectal pain, bleeding, or discharge from the rectum. And when we talk about these symptoms, again, I want you to keep in mind that you might think that it's something else. And that's really something that a lot of these STIs can feel like it's something else. Like, oh, I've been constipated for 3 to 4 or 5 days. It's happened before. it may not be anything. Let me just wait it out. And that's really what a lot of people do. But if you have access to a doctor, it doesn't hurt to ask them and be like, hey, just ask them to do tests just to make sure. You want to be sure that you are getting the treatment that you deserve if it's there and if it's available. And if it's not, you can always come to our clinics. Testing can be done by doing urine samples, cervical swab, urethral swab, vaginal swab, throat swab, or rectal swab. And this is for chlamydia or gonorrhea. This is how they test for it. They also do a urine sample on both of them as well. And healthcare providers can order one or more of these tests depending on the kind of sex a patient has. Now, I'm going to talk about the sex itself that includes the body parts. So if some of you might get a little bit uncomfortable on this, I'm sorry, but we need to cover it. So chlamydia and gonorrhea and all of the other STIs that we're going to mention can live in different places in the body. So the mucous membrane in the throat, in the vagina, in the anus, and in the penis, the mucous membrane is a much thinner layer of skin that's very absorbent. And that's what they swab. They swab your throat, they swab your rectum, the vagina, the urethra. The urethra is the little hole where you pee from, the cervical, or they do a urine test to double check on this. So this is what healthcare providers can do to double check and see if you have an STI or not. And again, it depends on the length of time that one may have had it or may not have had it, that they may have to do another test in a week or 2 weeks or 30 days. But the healthcare provider will let you know. The key part is to always be honest with your healthcare provider and let them know what you've been doing and what body part you've been using. So why treat chlamydia or gonorrhea? Oh, I think I see a question. If you don't have any symptoms, how can you catch these infections? Do you suggest regular testing? Yes. It says answer live. I'm going to answer live. Yes. So if you don't have any symptoms, one of the things that we're going to talk about later on today is PrEP, which is pre-exposure prophylaxis. And what that brought to the table was for people to do continuous testing every 3 to 6 months with their primary care physician who gave them PrEP. And we're going to talk about PrEP a little bit later as well. But it's a preventive medication, a daily medication that you can use to prevent HIV. And again, we'll talk about this more. But what that brought to the table was more consistent testing. And that is suggested for anybody that's sexually active. And when we talk about being sexually active, we don't necessarily talk about just intercourse. You can be sexually active and have oral sex. You can use your hands. You can use your body's different body parts for any kind of sexual gratification. And because of it, there might be an STI that may not have symptoms, or it may have symptoms that you think are something else. Like we talked about the constipation that can last 3 to 4 days. It could be something else. Or you can get a rash and you think it might be something else. So it's always important that if you know that you're sexually active, to double check with your doctor. But it's in good practice for anybody that's having any type of, I guess, sexual contact, let's call it that instead of sex, sexual contact, to be tested by the doctors every 3 to 6 months. I hope that answered the question. All right, so we'll move on to the next one. So why treat chlamydia and or gonorrhea or any STI? So specifically with chlamydia and gonorrhea, if left untreated, it can cause severe pain, infertility, or painful or swollen testicles. It can increase the risk of having a tubal pregnancy, also known as ectopic pregnancy. And it can make someone more likely to get or spread HIV. And we're going to talk about more about the last part when we get to the HIV section. But chlamydia is easily treatable with antibiotic pills, and gonorrhea is treated with an injection or antibiotic pills. So in New York City, there's also something called EPT, which is Expedited Partner Therapy. And what that means is that if you go and you are and you get a positive test for chlamydia or gonorrhea or trichomoniasis, Expedited Partner Therapy allows you to either receive medication or a prescription for your sexual partners And it doesn't have to be one or two. It can be whatever number of partners you may have that you think you may have gotten in contact with that either pass the gonorrhea, chlamydia, or trichomoniasis around, and you want to make sure that they come in and get tested, or if they can, that they can at least get treatment. And we're going to talk a little bit more about EPT in the next slide. Oops. There's the next slide. So as I mentioned, it's a clinical practice of treating sex partners of patients diagnosed with an STI by providing prescriptions or medications to the patient for their partner without examining the partner. So EPT for chlamydia has been permissible in New York since 2009, and EPT for gonorrhea and trichomoniasis has been permissible in New York State since January 2020. Although regulations and provider guidelines are still forthcoming on that. And I don't have a slide on this, but data that we collect for patients that come to the sexual health clinics, we can see an uptick of gonorrhea and chlamydia and syphilis well from 2020 to 2021 and into 2022. So that's, we released a health bulletin, I believe it was early 2022, letting folks know that young women of the age of, I believe it was 15 to 29, I'll have to double check this, we're getting the highest rates of chlamydia and or gonorrhea. But I'll share those numbers at the end of this training so you can all see it if you're interested in numbers. So sexual partners of patients diagnosed with chlamydia, gonorrhea, and or trichomoniasis infection since their last STI screening are eligible for EPT. There is no limit on the number of partners that are eligible. And we have an EPT, I don't want to call them a group because it's really just one person, but we have an EPT person at the Department of Health to answer questions. And this can be provider questions. So if PSS has questions and they want to ask our EPT department for more information, you can email ept@health.nyc.gov. You can also go to nyc.gov/EPT and get more information as well. So I see another question in Q&A. Is EPT covered by insurance? That's a great question. So depending on where you go for EPT, if you go to one of our sexual health clinics from the Department of Health, EPT is covered by your visit. And when I say your visit, meaning that if you gave the information for your health insurance, then it will be covered. But if they give you a prescription, for example, let's say that you come in and you say that you have 3 partners and you don't know where the gonorrhea and or chlamydia came from, and they give you 3 prescriptions for EPT, 3 prescriptions for the medication to treat chlamydia, gonorrhea, or trichomoniasis, then when that other person goes to get the medication, then they can either supply their health insurance, which should cover it because it's medication, or if they have no health insurance, if they have Medicaid or Medicare or one or the other, it should still be covered. But I hate to keep promoting the sexual health clinics. If you come to one of our clinics, it'll be covered by us, meaning that by whatever information you bring. I hope that answers the question. And I see that Sarah's typing the answer. Thank you so much. So part of gonorrhea and chlamydia discussion is also going to include pelvic inflammatory disease. So I'm going to jump on over to pelvic inflammatory disease, which is also known as PIV. And that is one of the outcomes of untreated chlamydia or gonorrhea. PIV is a condition that results from the bacteria migrating from the vagina where the infection first happened, where the STI was, going to the upper genital tract, infecting reproductive organs, including the fallopian tubes, ovaries, or uterus. And if left untreated, PIV can cause scar tissue inside and outside of the fallopian tubes, and ectopic pregnancy, which is when the fertilized egg gets stuck in the fallopian tube. And we're going to see an image of that in the next slide. It can also cause infertility or long-term abdominal pain. And this is not just like, oh, my abdomen hurts. This is like falling over from pain. And you'll know that it's something major that's going on in your body. Here we have an image of the reproductive system on the left, healthy reproductive system on the left. You can see the fallopian tubes on the top, the ovaries, which are the circles, or as some of my co-facilitators call it, the meatballs. There's the uterus in the middle, connected to the cervix, connected to the vaginal canal. It's on the left side. You see it there with no pus or abscess. On the right side, you can see that there's pus all along the uterus, the cervix, through the fallopian tube, and that there's an abscess, meaning that it's infected. The fallopian tube is infected, which is where we have the abscess. And if a fertilized egg starts to travel up the fallopian tube, it might get stuck there, and that's where it would grow. And you don't want that because it can cause, it can be severe to the host or the pregnant person, and it can even cause death for both the baby and the pregnant person. Any questions on this? All right, so we'll move on to the next slide. So we're going to jump into syphilis. Syphilis is also a bacterial infection, just like chlamydia and gonorrhea. It is characterized by different stages, including primary, secondary, and latent syphilis. It is also spread through oral, anal, vaginal sex, but you can also get it through close contact with an infected sore. It can also be spread to a baby during pregnancy, and condoms and dental dams do offer the best protection if it covers the area where the infected sores are, and healthcare providers can test for syphilis using a blood sample. Syphilis can be treated with an antibiotic injection, and we're going to break down primary, secondary, and latent syphilis in the next slides. But so that you know, people with primary or secondary syphilis are treated with a single shot of penicillin, and people with latent syphilis are treated with 3 shots of penicillin, each 1 week apart. If you're allergic to penicillin, there are other options using a drip that your healthcare provider can suggest. Here we have an example of chancre on the tongue, which is where the syphilis infection went. Sorry, let me rephrase that. Where the syphilis bacteria entered the body, and then they're usually painless. So you can see it's like an abscess. It sinks in. It kind of looks kind of like acne. It's a sore. It's a chancre, they call it, but it's usually painless, and it goes away on its own within 3 to 6 weeks. So a lot of people may just think, oh, it went away, so it's nothing, maybe a bit my tongue. Or they may have it somewhere else where they can't see it. It might be inside the vagina, it might be inside the rectum, it might be inside in the throat or on the side of on the cheeks on the inside. So you may not even know that it's there. The second stage of syphilis, which is usually 6 to 12 months after being infected with syphilis, is called secondary syphilis. And this is characterized by a rash, usually found on the palms, bottom of the feet or torso. And you can see in the image, you have like these dark spots. They don't necessarily have to be dark brown like in the image. They could be red, they could be white, they could just be a lot of spots on the hands, bottom of the feet or torso. The rashes can appear before the chancre heals. So you may have a chancre. Let's say that there's a chancre on the penis, on the shaft of the penis, and then you get a rash like 2 or 3 weeks later. It could be that the chancre happened later on after infection. So the chancre can happen anywhere between 1 and 6 months of being infected, and secondary syphilis happens 6 to 12 months. So the rash usually does not itch, and it's just there. And again, this also goes away on its own after a couple of weeks. So some people may think, oh, I'm cured, it went away. But as we talked about this, some of these symptoms may just go away, but the infection is still there. Other symptoms can include patchy hair loss, fever, swollen lip glands, weight loss, muscle aches, and fatigue. And latent syphilis is when you have had syphilis for 12 or more months after infection. And we also call it latent syphilis if you had it for more than 12 months or unknown. Because somebody can have syphilis for 10, 15, 20, 30 plus years and not know it. And the longer you have syphilis, the more it can affect the body. There's a couple of famous people that have passed away from syphilis. I can't think of a single one at the moment, but there are some famous people that passed away from syphilis. I think it was Al Capone that passed away from syphilis. I don't remember. Somebody Google check me on that. But this can affect your nervous systems, your eyes, your mind, and that is if you have it for 10 plus years, that can happen. It starts deteriorating your body. So it's always good to be tested. Now with syphilis, there's a syphilis titer, which I won't get into much detail, but if you had syphilis once in the past and you had it cured, it's going to be registered in this database where syphilis remains at a specific number. So they will test you. And if you get another test of syphilis, that might come back as looking like it's positive, but the doctor will ask you, have you had syphilis in the past? And if you tell them yes, they will check the database and then they will compare the numbers. If the number score has gone up, that may mean that you have a new infection. If the numbered score has remained the same, then we're looking at the same infection that was treated and no treatment is necessary. So always important to talk to your doctor about it. So I see a question. Does syphilis become untreatable after a certain period of time? Yes and no. So I'm going to go with no, because if you get it treated before you have any of these long-term symptoms, like once it attacks your nervous system, you can still get treated for syphilis and it won't do any more damage, but the damage it did will remain in your system. So it's always best to get it treated as soon as possible. One more part of syphilis is congenital syphilis, which is when it occurs when a pregnant person with syphilis passes the infection to their baby during pregnancy. And both syphilis and herpes can be passed to babies during birth. And congenital syphilis can cause miscarriage, stillbirth, prematurity, low birth weight, or death shortly after birth. So always important to get tested. I believe it's mandatory now in New York City, at least, to get tested for syphilis. Any pregnant person is mandatory to get tested for syphilis during the 3rd trimester, but that's if they're getting treatment. Thank you, Sarah. I see the question was answered. I'll move on to the next one, which is HPV. And if I'm going too fast, please let me know. Jump in chat. I don't know if you can unmute yourself, but just let us know if you have other questions or you need to go back. We have a lot more material to cover. So the next one is HPV, human papillomavirus, and it is the most common STI in the United States. You've probably seen commercials for it on the television or in magazines because they promote the vaccine, which we're going to talk about in the next slide. It is spread through vaginal, anal, oral sex, and also through genital to genital contact. So what does genital to genital contact mean? That means that, let's say that you're hugging or you're kissing and you're taking your clothes off and your body parts are rubbing, and one of the people that has HPV, they may not necessarily need to have a sore or a wart. Sorry, HPV does not have sores. They may not necessarily have a wart that's visible or any kind of rash, but it can still transmit HPV to the other person. But again, it's very common. And I want to say it's estimated that over 70% of people in the United States already have HPV if they have been sexually active. But I double checked the numbers for me. There's a website there. It's 73%, somewhere along those lines. So although there is no cure for HPV right now, the genital or anal warts can be removed with medicated creams and liquids through surgery or with laser treatment. Some warts also disappear on their own, and routine cervical pap smears can detect cervical precancer before it becomes cancer and is in a very treatable state. So again, emphasize the fact that you should talk to your doctors about everything that you're doing just to make sure, so that they know what to test you for. You may qualify for the vaccine even if you've been sexually active for X amount of time, because the vaccine prevents certain strains of the HPV, of the human papillomavirus. So you may not have been exposed to some strains, so the vaccine can still help you in that sense. So with the vaccine, it protects against 9 types of HPV virus, including the types that cause most cervical cancers. It is best to initiate the HPV vaccine series in early adolescence before sexual activity begins. But as I mentioned, it is also recommended for folks who are already sexually active because you may have not been exposed to other strains. The CDC vaccine recommendations are for preteens age 11 or 12, but vaccination can be started at age 9. Again, this is a recommendation by the CDC. It's not something that we're telling you that this is what you have to do, because people may not be sexually active until later on in time, but HPV can be transmitted in different ways, as we mentioned, through touch. So they don't have to be sexually active in the sense that we think about sex or intercourse. So they might still get HPV in some way. HPV can also be transmitted through oral sex. So that's something that we need to keep in mind. Persons through age 26 who were not previously vaccinated is also suggested that they get vaccinated. And some adults 27 through 45 who were not previously vaccinated may be at risk for getting new HPV infections, which are the different strains. So it's important to talk to your healthcare provider. Let me double check chat. Any questions? We'll move on to hepatitis A. So hepatitis A is a short-term infection caused by a virus. The first couple of infections that we talked about were bacterial, which was gonorrhea, chlamydia, and syphilis. They were viral. We just talked about HPV, and we're going to talk about hepatitis, which are both viruses. Short-term infection caused by a virus that can enter the body through the mouth and is passed in stool or feces. It can infect and damage the liver. Can you get the HPV vaccine if you're older than 45? That is something that you should talk. I'm going to say yes. But that is something you should talk to your healthcare provider about, because they would ask you more in-depth questions as to why you want to get the HPV vaccine at a different age group. But yeah, if you qualify, then yes. And that's determined through your healthcare provider. So hepatitis A can be transmitted during sexual activities, such as fingering. That's using your fingers in the sexual cavities, oral anal sex or rimming, fisting or using anal toys or sharing anal toys. Most people start experiencing symptoms about a month after being exposed, and they might get jaundice, which is the yellowing of the eyes or the skin. They might feel fatigue, abdominal pain, nausea, or diarrhea. So although there is no treatment for hepatitis A when symptoms appear, most people fully recover on their own by resting and not drinking alcohol. Since hepatitis A does affect the liver, drinking alcohol would make you feel not worse, but it might make you feel more symptoms. People with hepatitis A should also avoid taking drugs that hurt the liver, such as acetaminophen, which can be found in Tylenol. Some cold medicines, I believe, like Dayquil or Nyquil, also have acetaminophen. So it's suggested that they don't take this because it can affect the liver as well. Now, something similar to hepatitis A is hepatitis B, and it's also caused by a virus that infects and can damage the liver. Hepatitis B can be passed from one person to another through blood, semen, or vaginal fluids, and it can be transmitted during birth, by having condoms as sex, sharing needles, injection equipment, or getting unregulated tattoos or piercings. Most healthy adults do not have symptoms, and hepatitis B can turn into chronic hepatitis B, which is a lifelong infection that can cause permanent liver damage, leading to cirrhosis, liver failure, or liver cancer. So hepatitis B treatment, not everybody needs treatment if they have chronic hepatitis B. Antiviral pills can slow the progression of liver disease among people living with chronic hepatitis B, and liver cancer screening is needed every 6 months for people with chronic hepatitis B. But again, all of this will be determined by your healthcare providers. These are the recommendations that the CDC and the Department of Health has. One last part for hepatitis A and B is that there is a vaccine. There are vaccines for both or individuals. These vaccines have been part of a routine childhood immunization since 1994. I wish I had known when I had my son vaccinated because they gave him different shots. He wasn't happy about that. But you can get the hepatitis A and B vaccine together in a combined injection versus separate. Let me double check. Any questions? We'll move on to hepatitis C. If you think of something, please let me know. Just jump in there. I'm more than happy to go back. So hepatitis C is caused by the same virus or a similar virus that can damage the liver. It is passed from one person to another through blood, and it can be transmitted by sharing needles, injection equipment, during birth, unregulated tattoos and piercing, and condomless sex where there is the presence of blood. But the great news about hepatitis C treatment is that there is now a treatment that can cure and is 97 to 98% effective in curing hepatitis C on people. And this is an antiviral treatment that lasts 8 to 12 weeks, and it involves taking 1 to 3 pills a day. And again, like I mentioned, it's 97 to 98% effective. And this is great because this is new within the last, I want to say 2015, 2016 is when this hepatitis C treatment came out. Prior to this, you would need to take a full cocktail of medication that had a lot of side effects, and it was very expensive. Most folks could not afford it. Hepatitis C treatment is covered by most health care providers, but you would have to double check with your healthcare provider to see if you qualify. If you have hepatitis C and you need treatment, hepatitis C treatment is available for children, adolescents, and adults, people co-infected with HIV, and people who are actively using drugs. I don't see any questions, so we'll move on to herpes, but if you think of something, let me know. So herpes is another virus that can spread during skin-to-skin contact, similar to human papillomavirus or HPV, as we discussed earlier. It can spread through vaginal, anal, or oral sex. Now, there are two different types of herpes. There's oral herpes and there's genital herpes. Oral herpes is what causes those, I forget the name of it, cold sores, I believe that they're called, that a lot of people have. Now, that doesn't mean that you have herpes, the genital type herpes. It just means that you have herpes type 1, and it's very common. A lot of people have it, and it can happen to anybody that if you have kissed somebody that has herpes type 1, if you have shared utensils, if you share food, it's easily spread that way. So oral herpes can also spread through genital sex, through genitals during oral sex. So if one person has oral herpes and they do oral sex with another person, that other person could get oral herpes in the genitals. It can also be spread without having any visible sores, similar to what we were talking with HPV. If you're rubbing against each other, you're not wearing clothes, and there's the warmth there, you might transmit HPV to another person. With herpes, it's a similar idea. Even if you don't have any visible sores, the virus is still there, and you can still give it to another person. Many people with herpes have no symptoms, but people that do have herpes and they do have symptoms could have sores, and the sores can be painful. The sores can turn to scab, or they can heal without any scars. Blisters or sores can be hitting inside the vagina, rectum, or the mouth. Treatment and prevention for herpes, although there is no cure, there is treatment that reduces the outbreak frequency. It can shorten the outbreaks as well and relieve discomfort and decrease likelihood of transmission. So to prevent the spread of herpes, avoid having sex during an active herpes outbreak. And again, condoms and dental dams will only prevent the spread of herpes if they cover the infected area. Complications from herpes is usually the stigma and the shame is the worst part that most people discuss. There have been very few commercials on the herpes medication on television that I have seen, at least. And it's usually that people feel shame that they have herpes, so they don't discuss it. But it's a sexually transmitted infection. It happens, similar to HPV, similar to HIV, similar to all the STIs we're going to discuss today. Unlike other STIs, there are no physical complications of herpes like infertility or death. However, transmission during birth can have complications for the newborn, including death. So a person can have herpes for the remainder of their life, and they may get outbreaks every now and then, but there would be no implications. Like, it's not going to affect their liver the way that hepatitis does. It's not going to affect their nervous system the way syphilis does. So if there are no questions, we'll move on to trichomoniasis. We are halfway there. I feel like we're doing great on time. Again, if you have questions, let me know. So trichomoniasis is also known as trich. It is a parasitic infection that spreads through vaginal sex. So having trich makes it more likely to get or spread HIV, and we'll talk about that at the HIV slide. Trich is tested by swabbing the vagina just as a sample of fluid. Trich is treated with antibiotic pills, and sex partners can receive treatment via expedited partner therapy, or EPT. As we talked, if you go and you are diagnosed with gonorrhea, chlamydia, or trichomoniasis in New York City, if the provider that you're seeing practices EPT, which is expedited partner therapy, they can either give you the medication or the prescription for your sexual partners to be treated for this. So many people with trach have no symptoms, but if there are symptoms, it can include gray or yellow-green vaginal discharge, itching or irritation in and around the vagina. Condoms are the best way to prevent trach, and having multiple partners make it more likely to get trach. And that is because it's passed through sexual intercourse. Now, similar to trichomoniasis, there's bacterial vaginosis. So like a yeast infection, bacterial vaginosis is not technically an STI, and it is not spread between partners. It occurs because the normal balance of bacteria in the vagina is disrupted. And this can happen due to sex or multiple partners, using fingers, using different objects or toys. And this can disrupt the natural bacteria balance in the vagina. So because BV is not sexually transmitted, it cannot be prevented with condoms, but BV is treated with antibiotic pills or creams applied to the vagina. Many people with BV have no symptoms, but when symptoms are present, and it can include great discharge, foul-smelling vaginal odor, especially after sex, itching or swelling in or around the vagina, burning during urination. And like we mentioned before, this could be triggered by new or multiple sex partners because it offsets the normal bacterial balance in the vagina, but it is not spread or transmitted between partners. We do suggest to avoid douching. Douching as one of my, I think we're going back years to one of my previous supervisors. She used to say that the vagina is a self-cleaning oven, and what douching does is just gets rid of all the good bacteria. So we suggest not to douche as well, especially using those over-the-counter boxes, douche sets that come with all those chemicals to clean out the vagina. Let me double check chat. I don't see any questions. We're going to move on to HIV basics. So in HIV basics, we're going to cover 4 things. We're going to briefly cover HIV. We're going to talk about PrEP, which is pre-exposure prophylaxis, PEP, which is post-exposure prophylaxis, and U equals U, which means undetectable equals untransmittable. And please put all your questions in the Q&A if you have them. So HIV is also known as the human immunodeficiency virus, and it's a virus that attacks the body's immune system and makes the person more likely to get other infections. Now, in the earlier STIs that we were discussing, like gonorrhea, chlamydia, trach, herpes, and everything, we kept mentioning that having one of those STIs can make it more likely to get HIV. And that is because, as we talked about the mucous membrane, the thinner layers of skin in the vagina, the rectum, the penis, the throat, if you have an STI that's causing sores or bleeding or micro tears, it can make it more likely to get HIV because pre-ejaculate blood, semen, vaginal and anal fluids or mother's milk can go through these broken parts of the thinner layers and infect the person with HIV easier. So if not treated, HIV weakens the body's immune system and can lead to AIDS. And what this means is that your immune system creates new white blood cells in order to prevent infections. Like in simple terms, it creates like all of these different types of white blood cells. And what HIV does is it attacks those white blood cells, destroying them while multiplying the virus itself. So there will be more virus versus white blood cells. So that makes it more likely for you to get secondary infections that you normally would not get. So the only way to know if someone is HIV is to get tested. Testing can be done at a partner organization, at your doctor's, at your provider. They usually do it through a rapid test or a blood test. A rapid test can be a finger prick. They can test using the cheek in your mouth, or they can take a vial of blood to do a thorough test. Condoms and dental dams do offer the best protection, and we suggest not to share any type of needles. Now, needles are not just used for recreational drugs. Needles are used for medication as well. So we suggest to always use a new, clean needle for anything and not share needles because you can transmit a lot of different STIs, including HIV. Next up, we have pre-exposure prophylaxis. And before I talk about what's on the slide, I will say that this is something that is very, very, very low used by cisgender women or by women in general. So the New York City Department of Health does have a campaign specifically promoting PrEP for women. And what PrEP is that it's a safe and effective medicine that prevents HIV. So PrEP does not prevent other STIs. That's very important to remember. We always talk about PrEP and condoms, because PrEP prevents HIV and condoms prevent the other STIs as well. It's like having an additional layer of protection. PrEP is available as a daily pill or an injection you get every 2 months. Cisgender gay and bisexual men can also take PrEP only when they have sex, and this is called PrEP on demand. So if you have the medication, it depends on which medication they give you. I believe it's Truvada that falls under PrEP on demand. You can take 2 pills on the day off or the day before you have sex, or you think you're going to have sex that may expose you to HIV. Then you take 1 additional pill the day after and 1 the day after that, so that it would be 4 pills in total. That's called PrEP on demand. But there's more information at nyc.gov/health, where you can search for PrEP, and it will give you the full details on this. Then there is PEP, which is post-exposure prophylaxis. And post-exposure prophylaxis is an emergency medication similar to PrEP, but this is for people who are HIV negative and they have been exposed to HIV and who do not have access to PrEP or PrEP on demand. So what this medication does is it gives you 30 days of HIV medications. They are antiretroviral medications. And what the antiretroviral medications do is, if you remember how we talked about the HIV virus attacking the white blood cells, multiplying and killing off the white blood cells, the PEP and PrEP medication protects those white blood cells or prevents the HIV virus from connecting so that it can multiply. So these medications are great, and the technology that they use, if you geek out on it the way that I do, it's great reading if you want to look at that. You can get in touch with the New York City PEP hotline, which is open 24 hours a day, 7 days a week, at 844-373-7692. We'll put this information in chat also at the end of the training, so if you want to take a look. You can also go to any clinic or emergency room and ask for PEP, and they would ask you a couple of questions as to why you think you need PEP, and then they will give you the medication. They won't let you leave without it. And they'll also do an HIV test first to make sure you were HIV negative when you're ready. The next one that we have is undetectable equals untransmittable, which is U equals U. You may have seen this run in some advertisements online or on the bus, and this is among people living with HIV. Treatment can reduce the amount of virus in the body to levels so low that the virus is undetectable. And people who maintain an undetectable viral load for at least 6 months cannot transmit HIV through sex. And this is known as undetectable equals untransmittable. So if a person that is HIV positive is taking their medication, sorry, my alarm was going on. All right, I see we have questions.
Carlos, I think you just need to repeat that last little bit. I think your microphone cut out, I believe. If you mind repeating just like the last little bit. Yeah, just repeat the last little bit you just said.
Yeah, can you all hear me? My alarm was going off on my cell phones.
We can hear you now. Definitely can hear you now.
Great. So undetectable equals untransmittable is for people that are HIV positive, and the treatment can reduce the amount of virus in the body to the level so low that the virus is undetectable. And what this means is that, as we talked about before, on how PrEP and PEP can help prevent the HIV virus from connecting to the white blood cell to multiply, it works in a similar way, where the viral load of HIV has gone down so low to a specific number, and if you maintain that number for 6 months, you cannot transmit HIV through sex. So this is known as undetectable equals untransmittable, or U equals U. I see there's another question that says, is there a reason why only certain STIs have preventive vaccines and medications? I'm going to give my personal opinion and then professional opinion. Personal opinion, yeah, it depends on the science that's out there now. So my personal opinion includes this fascination with antiretroviral medication and mRNA science that came through because of COVID, because all of the scientists came together to figure out how to make a vaccine for COVID so quickly. They passed these different types of methods that they were using. And one of them is mRNA. And if you look it up online, they're actually working on an HIV vaccine as well using mRNA technology, which is incredible in my opinion, even to be able just to get to that step to think of creating this. But to bring it to the professional level and the non-geek level, yeah, there are certain types of medications and treatments that need to be passed through the FDA and through the CDC in order to make it available to the public. And these tests take time in order for it to be approved. So there are certain vaccines available now. Some are being worked on. Some haven't been approved yet. Oh, but the hepatitis C treatment, that was incredible. Again, if you want to geek out with me, you can look it up online. And when it came out, that was awesome in the sense on how the science that they used in order to create this cure or this treatment that cures a person for hepatitis C, whereas people lived with hepatitis C for almost all their lives in the past. So it's breakthroughs, science, hashtag. I hope that answers your question. So I see we're almost at times, but we're almost done anyway. We're going to talk about the sexual health clinics. Close this window down. The New York City sexual health clinics, as I mentioned, we have 8 locations in New York City. Currently, 5 of them are open and with walk-in basis or telemedicine. The other 3 clinics are being used for other services like COVID vaccines, monkeypox, etc. Services are rendered irrespective of ability to pay, insurance status, or immigration status. So let's say that you don't feel comfortable with your doctor. You don't want to talk about you don't want to talk about sex with your doctor, and you want to go to somebody that you may never see again. You can come to one of our sexual health clinics and let us know what you need. We are respectful, we are professional, we can keep things on the down low if you need us to. If you don't want to use your insurance or Medicaid or Medicare, let us know. We'll find a way to get you the services that you need when you're there. The services are confidential, no documentation needed, and clients as young as 12 years and up can go with the parental notification. That is by law, not necessarily by policy by us. On the next slide, we're going to see some of the services that you can get at the sexual health clinics, which include STI and HIV medical evaluations for signs and symptoms. And you can also get HIV and STI testing and treatment there. You can pick up condoms, you can pick up lube. By appointment, we do ask folks that if they want to get IUDs or some type of birth control that they need, they can call our sexual hotline, our sexual health clinic hotline, I'm sorry. Our sexual hotline sounds wrong. Our New York City Sexual Health Clinic hotline at 347-396-7959 to speak to somebody about PrEP initiation or getting an IUD or an implant to make sure that we have these available the day that you want to come in. That way you don't come in and you're turned away. We also offer partner services, which the New York City Sexual Health Clinic staff will call, text, email, or visit New Yorkers diagnosed with a certain STI to ask information about their treatment, about their sexual behaviors, names of sex partners, or contact information of sex partners. So if there's anybody in the room that has worked doing HIV testing, if you have ever gotten an HIV positive test from a client, you know that there's all these additional forms that you need to fill out. And we will ask that client if they can give us more information about their sexual partner or partners, because we want to make sure that they get the treatment that they need and that they deserve in a timely manner. We don't just want to leave these people out in the cold without any help. All right, so we are almost on time. We're almost perfect. We're going to cover 3 more things. Communicating. There's no one right way to talk to your partners about having an STI, but there are some basic tips that might help. Try to stay calm and remember that you're not the only one dealing with this. So everybody in the webinar right now, if you're thinking about talking to your partner about getting tested with STIs, just make sure to know your facts. Some of the information that we shared today, if you retain the information, you can share some of this information. You can go to nyc.gov/health and look up Everything that you saw on the slides, it's on nyc.gov/health. So if you need more information there, so if you can point to something and say, this is what I think we should talk about, then you can use that. But also think about your timing, because safety is important. If you're afraid that your partner might hurt you, or you're probably better off with an email, text, or phone call, you can also call the National Domestic Violence Hotline if you think you might be in danger. The National Domestic Violence Hotline is 800-799-SAFE, SAFE. And a lot of folks ask, what happens when I get tested? And I've been saying this throughout the entire discussion, is staying healthy starts with telling your doctor everything. And I put the word everything in caps and bold, because you need to tell your doctor everything so that they know what to test. The doctor may not ask you. If you tell your doctor, I haven't had sex, because what you're referring to is you haven't had intercourse, but you had oral sex, or you had anal sex, or you were rubbing against half a dozen people. You need to tell your doctor that so that they know what to test for. So that includes discussing your sex life and drug use. And there's a lot of recreational drug use that happens. And in some of the slides that we discussed, we talked about alcohol and or drug use that might lower your inhibition. So it's important to tell your doctor of this as well, because you might be sharing needles, you might be sharing pipes, you might be sharing something that could have blood or semen or something in it that can transmit STIs. So it's very important. So as we mentioned, depending on the type of sex you have, you might need to do the following, which is pee in a cup. They'll swab your throat or your butt or your uterus, your vagina. They might draw blood. And if you're not comfortable with your doctor, we can help. The New York City Department of Health can help you. You can call 311 or visit nyc.gov/health. We also have LGBTQ specific doctors, or a directory that can connect you to doctors to find an LGBTQ knowledgeable doctor near you. And one last thing that I always like to bring to the table is Thrive New York NYC WELL. And what this is that it's a 24-hour-a-day, 7-day-a-week service that you can call on the phone, you can text on your smartphone or your tablet, or you can go on the website and chat on your computer, your iPad, or whatever, and talk to a trained counselor that can offer you peer support and short-term counseling via telephone, text, or web. They can also connect you to somebody in real life if you want to see a counselor in person. They have suicide prevention and crisis counseling, excuse me, assistance with scheduling appointments or accessing other mental health services. And believe me, I try to access services all the time, and I work for the government, and I find it really difficult to do some of these things. And sometimes I do want to call them up and ask them to help me schedule appointments. But if you find yourself in a similar situation, please feel free to use the service. It's free. They can also offer follow-up to check that you have been connected to the care and that it's working for you, because you may be connected to somebody and maybe you don't like them, so you decided to go back. Well, NYC WELL will call you back to make sure that you're happy with your services. And if you're not, they'll connect you to somebody else. You can also use 711, which is the relay survey for the deaf or hard of hearing. And NYC counselors are trained to set calls from deaf and hard of hearing individuals using video relays. And thank you, Sarah, for putting that in chat. Does anybody have any questions? I see we are on time. Oh, I think there's one more question. Oh, well, thank you. You have a safe journey as well. I'm going to put my contact information on the screen. That's me. You can email me if you have any questions, or you can let Sarah and the folks at PSS know if you have any questions or follow-ups. I'm more than happy to answer any questions and connect you to any services that you may need.
Thank you so much, Carlos. That was so informative. I put as many of the links as I could in there, including the PrEP search, the PEP hotline. Definitely use all those resources. That's amazing. I don't think I knew half of those existed. So I think that's incredibly important. And I also think it's just incredibly important that we learn a little bit more about how untreated STIs can affect, you know, our organs and things. Is not just about, you know, if you're worried about pregnancy or anything like that. Like it goes far beyond that. And I think this is really important information. So thank you so much. Yeah, if there's any other questions, feel free. I think everyone said thank you. Oh, that's so sweet. I'm going to put our events in there as well, the link for that, and also the caregivers circle of care, just so you can grab that before we leave. And yeah, this will be on our YouTube channel as well, probably later on this week. So we can always kind of come back and you can use this as a resource. And Carlos, I mean, we would love to have you back. We'd love to have the Department of Health back. I think this is incredibly important, especially with all the new things that are coming out, like PrEP, like PEP, like the Hep C. I think that's just going to continue, hopefully. The more and more things will come out and we'll have more resources for people. So we'd obviously love to have you back.
Yeah, and thank you for having me. I also put nyc.gov/health in chat, and everything that I talked about here is on that website. You can search for PrEP, PEP, mucosal, or anything in there. So please feel free. And as I said, feel free to reach out to me as well. I'm always happy to answer any questions. I'm always around the city doing these trainings, so you may find me somewhere else. So thank you, everybody.